But as many of you know, there are now a number of centers growing up across the United States to provide direct services to adult survivors of cancer. The pediatric community actually started doing this back in the 1990s. They're actually well ahead of us. There are about 24 such clinics for pediatric cancer survivors, in part because of the unique challenges that those young survivors face secondary to treatment sequelae, whether those are neurocognitive problems, these are endocrine disorders, growth problems, et cetera, making their follow-up much more complicated, and the pediatric community very interested in trying to solve those problems and revise therapies to mitigate some of those. We're, again, a little behind the pediatric community in that, but these are beginning to develop. Many of these are affiliated with the large comprehensive centers, but they don't necessarily have to be. The models of staffing for these are very variable. There isn't a common standard in here. Some are led by physicians, some are led by nurse clinicians, some have psychologists, some have social workers or health clinicians, some have specialty physicians attached to these. They do know that they need to evaluate what they're delivering. So one reasonable question is, so what? If I go to this center, am I going to get any different care than if I went to my primary care physician and was simply followed according to some kind of guidelines? And that's a very good question to ask. And what's beginning to evolve is that there may be some kind of a stratification system whereby you might refer somebody who is a high-risk individual for multiple complications post-treatment, somebody, for example, who went through bone marrow transplant, stem cell transplant, expected to have multiple complications, might go to a very big specialty center where a lot of those individuals would be seen. Somebody who has some more aggressive disease, maybe stage 3 disease, again, where you're really worried more about some of these problems, had a lot of chemotherapy, you want to see them in some kind of intermediate sector here. And then perhaps you're sort of more common or garden variety, if there is such a thing in cancer survivor, who can simply be referred back to their clinical practice with consultation, if needed, with their oncologic group. So the question is, what kind of practices do these need to look like? And this is, again, one of the challenges that we have moving forward is, what do they look like? All of these programs provide surveillance, obviously, for cancer spread or recurrence, but they also are focusing on prevention, detection of new cancers, as this is a growing issue, and screening and intervening for the consequences of cancer, whether now or later, and using that opportunity also, as I said, for health promotion. So those are the basic components that are in each of these programs.